The drugs used in obstetrics have a huge impact on the outcome of both mother and the baby. The drugs used during the first trimester can produce congenital malformations, and the period of greatest risk is from the 3rd to 11 weeks of pregnancy. During second and third trimester, drugs can affect the growth and functional development of the fetus, or they can have toxic effect on the fetal tissues. These are the drugs used during labor: oxytocics, anticonvulsants, analgesics, and anticoagulants. In this video, we will be discussing about the oxytocics. Oxytocics. Oxytocics are the drugs that have the power to excite contractions of the uterine muscles. Among a large number of drugs belonging to this group, the ones that are very important and extensively used are oxytocin, ergot derivatives, and the prostaglandins. Let us see one by one. The indications of oxytocin during pregnancy is to induce abortion or labor, to expedite expulsion of hydatidiform mole, for oxytocin challenge tests, to stop bleeding following evacuation. During the labor, it is indicated to augment labor in uterine inertia, to prevent and treat postpartum hemorrhage. During postpartum, it is to initiate the milk letdown and breast engorgement. The contraindications of oxytocin in late pregnancy includes grand multipara, contracted pelvis, history of LSCS or hysterectomy, malpresentation. During labor, all contraindications mentioned in pregnancy, obstructed labor, incoordinate uterine actions, anytime hypovolemic state or cardiac diseases. The adverse effects of oxytocin includes hypertonic uterine activity, fetal distress and fetal death, uterine rupture, hypotension, neonatal jaundice, water retention and water intoxication. The dosage and routes of administration of oxytocin: controlled IV infusion 10 units of oxytocin in 1 liter of RL or 5% dextrose in water, nasal spray for milk letdown. Nurses' considerations include assessing the patient's input-output ratio, uterine contractions, BP, pulse and respiration, administer by IV infusion after having crash cart available in the ward, evaluate the patient's length and duration of contractions and notify the physician about the contractions lasting over 1 minute or absence of contractions. The ergot derivatives. The ergoid alkaloids are either natural or semi-synthetic. The preparations of ergometrin include 0.25 mg or 0.5 mg ampules and 0.5 to 1 mg tablets. Methergin 0.2 mg ampules and 0.5 to 1 mg tablets. Synthometrin ergometrin 0.5 mg plus syntocinon 5 units per ampules. There is an important note to be considered. The ergometrin and methergin can be used parenterally or orally. As the drug produces titanic uterine contractions, it should only be used after delivery of the anterior shoulder or following delivery of the baby. It should not be used in induction of labor or abortion. Synthometrin should always be administered intramuscular. The mode of action: ergometrin acts directly on the myometrium. It stimulates the uterine contractions and decreases the bleeding. The therapeutic indications include to stop the atonic uterine bleeding following delivery, abortion, expulsion of hydatidiform mole. Prophylactic indication as a prophylaxis against excessive hemorrhage, it may be administered after the delivery of the anterior shoulder with crowning and following the delivery of the baby. The contraindications suspected pleural pregnancy, organic cardiac diseases, severe preeclampsia and eclampsia. Adverse effects may lead to rise of BP due to vasoconstriction action. Prolonged use in puerperium may interfere by decreasing the concentration of prolactin and gangrene of toes due to vasoconstriction. The dosage and routes of administration. For active management of third stage of labor, 0.2 milligram to be given intramuscularly. For control of atonic pph, one ampule slowly over 60 seconds may be repeated after 2 hours. For excessive lochia and subinvolution, one tablet, which is 0.125 milligrams, 3 times a day for 3 days. Nursing care includes to assess the patient's BP, pulse, respiration, signs of hemorrhage. Administer orally or intramuscularly deep, have emergency cart readily available. Evaluate for decreased blood loss. Advise the patient to report for increased blood loss, abdominal cramps, headache, sweating, nausea, vomiting, and dyspnea. The next drug which is under the oxytocics are the prostaglandins. Prostaglandins are synthesized from one of the essential fatty acids, arachidonic acid, which is widely distributed throughout the body. In the female, these are identified in the menstrual fluid, endometrium, decidua, and amniotic membrane. The various preparations of this medication as a tablet 0.5 milligram is available. Apart from that, prostin E2 dinoprostone, prostin F2 alpha 125 and 250 microgram injection, prostaglandin E1 misoprostol as a tablet 100, 200 and 600 micrograms. The action includes both PGE2 and PGF2 alpha have an oxytocic effect on the pregnant uterus. They also sensitize the myometrium to oxytocin. PGF2 alpha acts predominantly on the myometrium while PGE2 acts mainly on the cervix. The indications of this medication is used for induction of abortion during the second trimester and expulsion of hydatidiform mole, for induction of labor in IUD or fetus, in augmentation and acceleration of labor, to stop bleeding from the open uterine sinuses as in refractory cases of atonic PPH, cervical ripening. The contraindications are hypersensitivity, uterine fibroids, cervical stenosis, and PID. The nurse has to assess the patient's respiratory rate, rhythm, and depth, vaginal discharge, itching, or irritation, administer antiemetic or antidiarrheal preparations prior to giving this drug, evaluate the patient for length and duration of contractions, advise the patient to remain in supine position for 10 to 15 minutes after the vaginal insertion. No drug should be administered to a woman during pregnancy, labor, and birth unless the woman is fully informed to the known risks and the relevant areas of uncertainty regarding the effects of drug on the physiologic and neurologic development of the woman on her baby. The drugs that are used daily in obstetrics can have a huge impact on the outcome of both the mother and the child. Therefore, obstetric providers need to have a very clear understanding of the mechanism of action. doses, and side effects of the most commonly used drugs. Thanks for watching. If the contents of this video are informative and useful, subscribe the channel, like the video and share with your friends and colleagues.